Okay, the next one now is the Vicos triad. So in the Vicos triad, the first element is a venous blood stasis. So in venous blood stasis, you need to know that what when blood from the vein is going to be in stasis, that it does not move, it can coagulate, it can promote coagulation, and the promotion of that coagulation is going to impair. Let's think that there is a blood clot inside the veins. Is it clear? When there is blood clot inside the vein, it impairs the venous return. That's why it is called a secondary venous disorder. Anything that is going to impair the venous return is going to be a venous disorder. Is it clear? So the venous blood stasis, the blood is accumulating there, so we can promote the formation of the blood clot. And now, what are the risk factors under venous blood stasis? If somebody have done any orthopedic surgery, you're not going to move, particularly orthopedic surgery of the lower limbs. You're not going to move for a long period of time. So that's why you are prone to have a blood stasis. If somebody has done any articular surgery or joint surgery, is it clear? It's a risk factor. Is it clear? If somebody has done any cesarean section, they may not move if they don't move within the first day, it's a risk factor based on the blood stasis. If somebody has prolonged decubitus, any risk factor for prolonged. If somebody has any risk factor for prolonged decubitus, is it clear? Any risk factor for prolonged decubitus is going to be also among. So any other things is going to enter under the venous blood stasis. Now under the hypercoagulability, these are cases. The risk factors here are any disorders or any condition that can make somebody to coagulate excessively. The first disorder can be physiologic in the case of pregnancy. Is it clear? Pregnancy is a state of hypercoagulable productions. Is it clear? So after pregnancy, you can have now pathologic conditions which can promote hypercoagulable state. The first pathologic condition, we have the factor 5 Leiden deficiency. We have the proton beam abnormalities or proton beam disorder or proton beam mutation. The next element, and all that factor 5 deficiencies associated with the antiphospholipid. We have also the antiphospholipid syndrome, which can be associated with that. And after that, we have other elements which can be associated with the thrombophilias, like the idiopathic thrombophilias and all those different conditions there. So that's anything that can result to a hypercoagulable state. Is it clear? And also, peculiarly in hypercoagulable state are patients who are taking contraceptive pills. Is it clear? You need to know that contraceptive pills is going to increase prone to coagulations. Is it clear? So any patient that take contraceptive pills are also associated, particularly in females. Is it clear? That's the hypercoagulable state. Now, the next thing is the endothelial damage. Endothelial damage now is a question. You need to know that here, endothelial damage is not arterial endothelial damage, but it is instead a venous endothelial damage. Is it clear? So somebody should not say that hypertension is a risk factor for deep venous thrombosis. No, that is not the correct answer. Hypertension is not a risk factor of deep venous thrombosis. No. Because hypertension, when we say hypertension, is arterial hypertension. Is it clear? If you want to say that hypertension is a risk factor of deep venous thrombosis, you have to precise that it is a venous hypertension, because venous hypertension is a hypertension inside the veins. Is it clear? You can say that the venous hypertension is a risk factor of endothelial damage, which can result to deep venous thrombosis. Is right. Is it clear? And what are the things that can result to venous hypertension? Venous hypertension can increase peculiarly when you have an increase in venous tone, and the venous tone was the third mechanism among the things that can result to venous return. And we said that the venous tone can increase as a result of sympathetic nervous system activation. Is it clear? So if somebody has a pheochromocytoma, he may end up having a venous ulcer because of the sympathetic nervous system activation that results to an increase in venous tone. Is it clear? I hope you are understanding very well. So it's venous hypertension. Now the second element and the major element involved in the endothelial damage of the venous endothelial damage, this one has to be changed to venous endothelial damage, is infections. Is it clear? Infections are very important in causing it. Is it clear? Particularly, there are different infections that can result to deep venous thrombosis. When you have a cellulitis of the lower limb, cellulitis of the lower limb can infect at the level of the veins, resulting to deep venous thrombosis. Cellulitis and phlebitis, when you have inflammation of the superficial veins, is it clear? It can promote deep venous it can promote thrombophlebitis formation, because I said the secondary venous disorder is not just deep venous thrombosis, but it can be also superficial venous thrombosis, which is also called thrombophlebitis. Is it clear? So you can have a thrombophlebitis as a result of infections like local infection like cellulitis, or you have systemic infections. If you have any systemic infection, you may have also deep venous thrombosis from it. Is it clear? So those are the different things that you have to put in mind when they are asking you for the pathogenesis of the primary and the secondary venous disorder. In primary venous disorder, consider varicose vein, and this is most of the time congenital, while in secondary venous disorder you have to consider the venous triad, and you have to bring out the different element of the venous triad as you have done in this tutorial. Now the next point we are going to continue now is a clinical presentation.